to check it out. Oh, this is called tinnitus.
Hello, unknown stranger. What's going on?
This Google is telling tinnitus can cause brain tumor.
So, this is one of the most common things that we see when people like you have ringing and come to our clinic completely convinced that they have brain tumors or worse, strokes. While it is true that some cases it may be the issue, but that's very unlikely. So, don't panic. Let me tell you what are the first five things that you should do if you start getting ringing, and how you can resolve it even before you have to go in and see a doctor, and most importantly, when you know that you need to see a doctor. So let's go ahead and talk about tinnitus, the first five things to do, and when do you need to go see a doctor.
Hello and namaskar. I am Dr. Diptarka Bhattacharyya, and today we're going to talk about tinnitus, what it is, the first five things you should do, how you can manage it by yourself, and what are the situations where you need to worry about it being something more dangerous and you need to see a doctor. So let's get started. So when people come to me with tinnitus, as you saw in the first segment, they often come to me completely convinced either they have a stroke or a brain tumor, or third is that there is nothing that can be done for them. Tinnitus is untreatable. Now, all these three things are very unlikely. Brain tumors, strokes can be there, but we think about them because they're the most serious things that can happen. And we need to be sure that we don't miss even 1% out of 1,000 who may have a brain tumor. The third thing is that in today's day and age, with all the technology that is available to us, in my personal practice, being able to not help someone with tinnitus is probably 1 in 100 or even less than that. So the chances of you not being helped, you just suffering silently with it, is very unusual. So that being said, all treatment starts with understanding. So let's take a step back and understand what is tinnitus. So if you look at tinnitus is a very simple thing. Tinnitus is nothing but feedback. So that means that if you switch on the volume of a radio or anything too high, you get a beeping sound. Now that sound in our subcortical nuclei is what is identified by human beings as tinnitus. So if you think about tinnitus as a sort of hyperactivation or feedback circuit, now it will make sense. So the most common reason for tinnitus is that you've had a flight or you've had a little bit of a cold and the eardrums have gotten stiffened or some mucus is collected behind the eardrums. And in these cases, most people have this issue where they've had a cold a week back or something and now they've started getting this ringing in the ear. Now, if that happens, the most common reason is because of the mucus, the sound is not reaching the nerves. So you do have some ear blockage, a little bit of ear pain or heaviness may be there, but that blockage causes your nerves to become hypersensitized because your brain is trying to compensate for that hearing loss. And in these cases, what happens is that you start getting the ringing. So that would be the most common reason we see this. So that means if there's any hearing loss, to compensate for that, the brain may increase the signal flow. The second type of ringing happens if you have had an insane amount of alcohol for a birthday party or something like that. Now in that case, what happens is you've had so much stimulant, you've had too much coffee, you've been high stressed out, you've had alcohol, you're drinking. What happens in that case is that the general signal flow of the brain is elevated. This can also be elevated in anxiety, severe stress issues, poor sleep, any of these things that causes your brain signal flow to be increased because your brain is trying to keep you awake, or there is too much of stimulant in the system can cause a hyperactivation of these circuits. So when we look at patients with ringing, the first thing that I think of is this because of a hearing loss or is this because of a hyperactivated neural circuit? If it is because of a hearing loss, then my treatment focuses on fixing the hearing loss, because I know once I fix the hearing loss, that ringing will go away. The second thing is, if the hearing loss is not there, then I know that maybe there was a hearing loss in the past which is recovered, but because for some reason your brain signal is already a little bit elevated, it is taking time for the brain to bring it down to normal. In this case, we have treatment to soothe the nerves, and we have other treatment therapies that is used at the same time to increase the amount of sound stimulus to that particular side. All of this is geared towards letting the brain know that, hey, we don't have a hearing loss right now, so you don't need to keep it activated. So now that you understand these two subtypes, let's talk about what are the first 5 things that you should do if you get ringing. If you're getting ringing just today or a couple of days or 3-4 days, the first step is don't panic. So that is the most important, because what people do is they'll panic, they'll keep closing the ear to see if they're hearing the ringing. And this actually teaches your brain that you should focus on the ringing. So for example, if you're sitting in a room and there's a river flowing nearby, the first few minutes you will be able to hear the sound. But after 15 minutes, you're not even hearing the sound, because your brain has learned that that sound is constant, it doesn't mean anything, and your brain has learned to ignore it. Now, that is exactly what this is. If you keep focusing on the ringing, you're teaching your brain that this is a stimulus that you should be aware of. This is called cognitive reinforcement. So don't panic and don't keep reinforcing that. Don't keep checking that. If the tinnitus is bad enough, where it is serious enough, you will know even without closing the ear. The second thing that I normally tell people is rule out any red flags. So red flags are things which tell me that it could be one of the dangerous things that you come across on Google. So what are the red flags that you think of? Vertigo. Okay? That means dizziness, giddiness, spinning of the head, vomiting. Second is headaches. Severe headaches with ringing is something that could indicate very high blood pressure and an impending risk of strokes. Third is you have a history of any kind of heart disease. That means you have high cholesterol, very high ACVD risks, which your doctor would have told you. In those cases, you need to take ringing seriously, because it may be a sign of cardiac issues also. The fourth main red flag will be that if you're feeling any blurring of vision at the same time, because that could show that there's something else going on. The fifth is if you see that there is any kind of numbness on the face, on the side of the ringing, or you feel like when you're trying to eat or speak, your speech is not coming out clearly, then you need to take this up seriously. So step number 2 is check for red flags. Now, step number 3, once you've checked the red flags and you've realized it's not any of them, now it is time to do some breathing exercises. So this is the most helpful thing that you need to do in immediate cases. The easiest breathing exercise that we recommend is something called as box breathing. So if you just Google or YouTube box breathing, you'll see hundreds of videos on which you'll get a box like this and a ball will be moving in it. And you just have to breathe according to that. So you're going to breathe in when the ball goes up, you're going to hold when the ball goes sideways, breathe out when the ball comes down, and hold. We recommend doing this for 5 minutes. And for the first few days, whenever you hear the ringing, you, instead of panicking, you start doing the breathing exercise. This is something called as biofeedback, because this breathing actually helps us lower the signal flow, lower the heart rate, and lower the amount of activation in the neural circuits. So breathing exercises, anytime you hear it, will show very good results within 3-4 days. The fourth thing that you can do is, if it is still there, start taking some steam inhalation. Start doing normal things, because most likely it is related to a little bit of cold or a little bit of stress. So the next step is take some steam, take an antihistamine if necessary, and if you've been sleep deprived, maybe take a day off from work, just relax, give yourself some time. The other thing that would help in this step is if a job where you have to use earphones, then for the next 2-3 days, do not use earphones. Noise cancelling earphones actually suppress the surrounding noises in the environment, and these surrounding noises play a very key role in letting our brain know that the nerve is working fine. This has been more recently identified, and this ambient noise is a very important thing. So noise cancelling earphones actually reduce all ambient noise, and so can actually greatly worsen mild ringings and can even cause ringing in many cases. So if you're using earphones, try to avoid using earphones. You can take your office calls with a small desktop speaker, that is completely fine, but avoid using earphones. Finally, if you're someone who is a coffee drinker like me, try to avoid taking too much coffee or tea for the next 2-3 days. If you're a smoker, avoid smoking. If you have a party with friends where you're planning to drink like a fish, probably today is not the great day to plan for that. So the next step would be take it easy, cut out all the things that increase this. Also, dark chocolates are known to cause this. So dark chocolates would be a great idea to avoid for the next few days. And that's when you'd see this. Now we come to the final step, step number 5. If you do this for about a week and it still doesn't go away, or it seems like it is getting worse in spite of taking all the final steps, then is the time to see the doctor. Now, when you come in to see the doctor, all good doctors who are following the guidelines, the next step is for us to get a hearing test. Once we get the hearing test, in a very rare situation where the hearing test is going in favor of any of these rare issues like strokes or tumors, etc., then we may go ahead to more imaging like MRIs, specific scanning modalities, etc. If it is not, we are most likely give you some basic treatment like some tinnitus medicines, some exercises, stuff like that. Now, let's talk about, if you obviously before that, if you do have any red flags in step 2, you're not going to do the step 3, 4, you're going to skip to step 5 and see a doctor. Now, before we close out this thing, let's talk about what are the treatment options available. So in today's day and age, tinnitus has lots of different treatment options, because remember, tinnitus is not one thing, it is many different things. So if you think about someone who keeps getting this after flying, we have ways in which we dilate out the tubes between the ear and nose, which will actually prevent these tubes from getting blocked out, prevent the mucus from collecting, and prevent you from getting this. If it is because of any of these anxiety related things, obviously treating the underlying disorder helps a lot. If you are having an idiopathic tinnitus, that means that you have a tinnitus but there's no other underlying cause, then we have something called as a tinnitus retraining modules, wherein we have different options like vibratory therapies, wherein we use specific types of vibration to substitute for the hearing and to make your brain feel that there's a lot of stimulus coming in. We also have tinnitus matching devices, which basically will match the ringing at the exact frequency, and it will create a sound wave in that particular frequency to basically stun the brain. And once this is done for a certain amount of time, usually your brain keeps getting hit at that point, and your brain starts to learn that there's a lot of sound, so your brain starts to go down to the normal thing. In very rare situations, we do have small interventions which can be done, like injections into the ear if there is blocking a lot or if it is causing some neural issues. Those would be specific situations where there's a viral infection in the nerve, etc. But in most cases, these basic rules, if they're followed, people do great with tinnitus. So now that you know the first 5 steps, once again, don't panic, relax, follow the steps, and remember that even if we start digging in random places, maybe one guy will get a treasure and he will become famous. But the chance of you being that one guy is very less, and you being the other 999 guys who are digging mud is probably very high. So I would not be pessimistic and think that I'm the one who's getting a stroke or tumor. If you have red flags, treat it accordingly, take it seriously. Otherwise, relax, give it a few days. If in 1 week you don't feel better, see the doctor and we will definitely help you beat the tinnitus. So we do have another video that goes in much more detail about tinnitus, the subtypes, the causes, and I'll link it up here. You can go look it up if you would like to see more details about it, but this would be a great way to start thinking about tinnitus. Let's take care. Let's take care of our health. Let's cut down the anxiety. Let's cut down the cigarettes. Let's cut down all of these other things. Little bit of daily physical activities are very helpful in avoiding tinnitus related issues. So those things would be great. If there's any queries, feel free to reach out to us. There should be a subscribe button somewhere down here. Feel free to subscribe if you feel this was helpful. We'd love to stay connected. I'm Dr. Diptarka Bhattacharyya. We're Diptarka Bhattacharyya ENT, and I'll see you soon. Till then, take care. Have a nice day. Namaskar.